So this urgent care was actually started by my husband, Dr. Ugo Nwude, who is a trained emergency room physician. So Dr. Nwude and I moved here in 2014. I started work as a hospitalist, and my husband, who has already had some residency training in general surgery and some residency training in orthopedics and trauma, did realize that this area needed an urgent care because everybody went to the emergency room for things that are urgent but not life-threatening. We needed that, and he actually went ahead, developed a plan to start this urgent care clinic, and this was in 2015, and he started it. The community needed that extra access to healthcare, being such a rural place. So this was the first urgent care started in southern Arkansas within a 60-mile radius. And the extra access to medical care was the reason Dr. Nwude decided to start this urgent care. So the difference between an urgent care and an emergency room is that the urgent care bridges the gap between the primary care physician and the emergency room. Let's say, for example, you get home and you have a 6-year-old son who has known asthma. And of course, you get home and it's 5:30 p.m. and your boy is wheezing. You already know what needs to be done. He needs to be checked out and examined by an experienced healthcare practitioner. You don't have to go to the ER to wait for about 4 hours and use resources that can be saved for people with more serious life-threatening conditions like a heart attack or stroke. You can take this boy at 6 p.m. to the urgent care. He'll be examined. He will have the accurate medications right there and then in the urgent care center, and he will be stabilized to go home. Now, if you go to the urgent care and you are needing to refill your medicines which your primary care doctor has given to you, but because of one thing or the other, you couldn't get in on time to see him, but you need that blood pressure medicine, you need that blood sugar medicine, your cholesterol medicine, an urgent care is there for you to get that done. Let's say it's Saturday at 11 o'clock and you start having nausea, vomit, and diarrhea. You don't have to go to the emergency room to use up the resources that's being saved for someone that has a stroke or heart attack, or let's say a sudden change in mentation. Those are more serious life-threatening conditions. Saturday, 11 o'clock, 1 p.m., 6 p.m., you can go to the urgent care because we have extended hours to take care of that diarrhea and some other non-life-threatening but urgent enough for you to seek medical care. When you decide between an urgent care and an emergency room when the condition is non-life-threatening, you also have to consider the financial burden on our healthcare system. Even if you have health insurance, going to the emergency room will cost your insurance company about $2,000 to $3,000. While going to the urgent care for that sore throat, where you would get the strep swab or the COVID swab or some other kind of swab, will probably cost your insurance company only $100 or even less. But when you have to pay a copay for your urgent care visit, it might cost you anywhere between $10 to $50, while an ER copay can cost you anywhere between $150 to $500 for that copay. So you also have to consider the financial burden on the healthcare system, which going to an urgent care does alleviate a lot of that burden. So this urgent care has extended hours. We are open every day, Monday through Saturdays from 9 a.m. to 7 p.m. And on Sundays, we are open 1 p.m. to 6 p.m. If you walk into this door at 6:59 p.m., you will be taken care of. You walk into the door at 7 p.m., the staff will stop and take care of you until you are ready to go home. So we do have those extended hours. What I like is to be able to actually help someone who is in need and to actually see the result of what you're doing and just alleviate that pain. That just makes it worth it for me. I just love to be able to help people take care of their pain.
Okay, is there anything else you'd like to mention that I didn't ask?
We've had tremendous support in this community from the medical community and the general public since this urgent care started in 2015. We are still determined, and we're still I would say we're still going to stay focused on the mission, which is to continue to provide excellent health care to the entire Southern Arkansas and beyond.